I think if you guys can introduce yourselves to all of us, I mean, many of them know you already, but for people who are new on this forum, if you could go one by one to introduce yourselves, that'll be great. I will be on mute.
All right, I'm gonna go first. So I'm Beatrice. I'm a PGY3 internal medicine resident here in Tupelo, Mississippi. It's a new program and we're the first set. And this is my first time of applying to Heme and I matched. I'm happy to meet you all today and I'm happy to get this opportunity to be able to help. Nice to meet you all.
Thank you, Beatrice.
I can go next. Hi, I'm Sindu, and I'm currently working as a myeloma hospitalist at UAMS, and I graduated in 2022 from residency, and I did a one-year non-accredited fellowship at Cleveland Clinic, Florida, last academic year, and that was the first time I applied and did not match, and this was the second time I was applying, and fortunately matched into Augusta University. That's a little bit about me.
Thanks, Sindu.
Hello, everyone. Can you hear me? Hi, I am Milan. I'm pretty old graduate. I graduated from my internal medicine residency in 2016. And since then, I've been working as a hospitalist at Mayo Clinic Health System. And this year I applied and I made it University of Minnesota program. And I'm really happy to be here and I'll be very happy to share my experience. Thank you for having me.
Thank you. So 3 different people, 3 different paths. So let's start with Milan. After working in or as a hospitalist for this long, how did you decide to choose hematology oncology, or did you always wanted to be an oncologist right from residency or even before that?
Sure. So actually, I always liked oncology, but I was not 100% sure right after my residency if I wanted to do this. I had some personal story. I had some family member who has gone through cancer, and so I was really inspired, and that was the reason I went to actually medical field. So when I graduated at that point, I have family. I have 2 kids at that point, and also I'm on visa. So I thought that I should, get my green card settled, and then I can apply after that. After getting green card, I can apply for my fellowship. But then, I got kind of settled in my new role as a hospitalist. I really liked working as a hospitalist, and because I liked it so much, and I was working at a very good institute. So I just continued with it. But over the years, I realized that, I was missing this thing because I always wanted to be an oncologist. And then I just got distracted kind of. So 2 years ago, I just started working on my profile so I could apply. Then year before this like previous match, I had some issues with my health, so I couldn't apply that year. So this year I applied and it went well. And the lesson I learned that and I would like to share with everyone else because I can see that I'm probably my profile is different compared to other folks here. So the lesson is don't delay your dreams. Because if you divert and then life throws different things on you. So yeah, that's my short story.
Wow, short but inspiring. I'm in a similar boat like yours. I'm a very old graduate from India. I did my residency back in India, moved here, had a huge gap because I had kids, and now I'm in residency. And because I did not match this time, I'm now rethinking if I should actually apply next year or give it a break and work on my profile. But I think you have really inspired. It do not delay your dreams, which is true for all of us here on this forum. I believe that.
No, totally agree. And you never know because You just need to match it one program. Folks from us, we all have different number of interview calls, but we all matched at one place. You might get one interview and you do so stellar performance. I think everything depend on that day. So I have seen someone, who got matched in cardiology with just one interview this time. So I'm so inspired. And I think you should definitely apply. I will 100% recommend that. But certainly, you have actually enough time to work on your profile. You can publish and, get involved in more things. You can work as a hospitalist or might be doing, one fellowship like Sindhu's doing, I think, so something like that. Yep.
Yeah, so Sindhu, you did a myeloma fellowship at Florida, right?
Just a correction. So I did an investigative cancer therapeutics fellowship last year, but right now I'm working as a myeloma hospitalist. So
I see.
yeah, so yeah, I know it was new to me. This world is new to me, like the branch and everything. But I predominantly take care of myeloma patients here who are having bone marrow transplants and CAR T therapy, and take care of, you know, them predominantly, but we do have positions for onco hospitalists. So UAMS has onco hospitalist group and myeloma hospitalist group. The onco hospitalists specifically take care of patients with other kinds of cancers, and the myeloma hospitalist predominantly takes care of myeloma patients. So yeah.
So how did you use this training of yours with this hospitalist job of yours to strengthen your application? We can't hear you, Sindhu. No. Okay, let me mute now.
Hi, can you hear me now? Yeah, okay, cool. So I don't know how much of what I spoke was heard. So I think it was a series of things because I just started the myeloma hospitalist job when I'd applied for the second time. So I think it was what I did prior to that mattered more to get the interviews. And once I was interviewing, I think the myeloma hospitalist job came into picture because we had more conversations at an attending level, like what are the, downside, what are the insurance stuff, and that's something that you would learn only when you're working rather than being a resident or a fellow. So I think residency, I come from a community program, so couldn't do much other than case reports, but I just grabbed whatever opportunities I had and did not apply in my third year because I was not confident about the match at that point. So I had decided to do this 1 year non-accredited fellowship in investigative cancer therapeutics to just strengthen my CV, both clinically and through research. And I think that kind of helped me get a kickstart. Yeah.
That is good.
And
Okay, echoing again.
Is it echoing? Let me
Yes.
just log off and then I'll log in back. Yeah.
Sure. Beatrice, so you tell us, yours is a first class of your residency, and is that a community program as well? And how did you strengthen your application?
Yeah, it's a community program in rural Mississippi. Initially, it was very challenging because we're the first set, and I was the only one that applied to Heme. And coming from as an IMG, I didn't know where to start from and how to go about things. So what I did was that towards the middle of PGY2 here, I reached out. Okay. I reached out to. Oh, can you mute so that I'm going back? Okay. So towards the mid of PGY 2 year, I reached out to the private group that works for the hospital, the oncology group, and I reached out to the oncologist there to kind of guide me on how to go about things. So what they told me was to try as much as possible to go out to do an elective, to kind of get letters from outside, from a place that has fellowship. And that is also another battle for a new program. So there's no, I had issues with the insurance, the medical insurance from my hospital and the license from the states that I applied for the elective. But the good thing is that I was resilient and I persevered. I spoke with my PD multiple times that if the hospital was not going to help with the insurance, I was going to do it myself. You know, when they saw that, they kind of worked a way around it and helped me to get the insurance that will cover my stay at the University of Tennessee, Memphis. So that was where I did my elective. I did an elective for 1 month. That helped me. Then, in terms of research, I did not know anything about research. Then I had to reach out to people on LinkedIn to kind of guide me. So what I had was more of case reports. And these case reports were not really hemonc. Most of them were maybe rheumatology, cardiology. I had just 2 case reports that were hemonc, but I kind of wrote a lot of case reports and made use of what I had in my program. Another thing I did a quality improvement project, and I kind of helped with creating a pain management order set for sickle cell acute pain episode management. So that helped because during my interviews, they kept referring to that. Then my CV is kind of well-rounded. I have volunteer experience. I volunteer at a free clinic here in Mississippi. Then I'm also involved in various outreaches, and these were kind of talked about during my interviews, and I believe they helped me with getting a lot of interviews. Then my personal statements and my letters were good, according to the feedback I got from the interviewers. So these were the things I believed helped me to match. And I was surprised with the number of interviews I got. I got a lot of interviews, above 20. I had to drop some. I wasn't expecting that turn up for interview. Yeah.
Wow, that is truly a success story. For a
Thank you.
newbie, for most of us that are here as PGY3s and IMGs, I think this is truly an inspiration, just like how Tulsi is for most of us here. She matched into Stanford too. So, Tulsi, why don't you tell everybody what you did? Hello?
Hi guys, I'm here. I didn't go anywhere. I think I mean today our guests are have very unique journeys, so I don't want to take limelight away from you, but I'm also kind of like Beatrice. I'm part of a new community program. I have only one board certified HEMONC specialist in my program that I rotated with. Because I was a new program, I requested if I could do an away elective, and mine was actually denied. So I was heartbroken because I didn't know where to go for even another oncologist in town. I didn't have any. So what I did was I had a hemonc trained physician in my hometown, and I volunteer extensively with the community. It's called Gift of Life Cancer Screening Program. She was trained as an oncologist, but she stopped practicing as one, and she was running the palliative center here in town. So what happened was I reached out to her and I set up, and she was so supportive. So she set up an oncology rotation, but it was palliative oncology. Now, this is a board certified internist who was trained in HEMONC but no longer practices HEMONC. So she wrote my second letter focusing on my elective in palliative oncology. The third letter, I believe in letters that are authentic. I don't like fake letters. I didn't feel comfortable asking pseudo letters, so I asked my favorite attending in infectious disease to write me a letter because he knew me. Everyone has infection, so I did a lot of rotation with him. He knew me, how I worked. And your letter should speak about your quality as a person and also how you take care of patients. So he wrote my third letter. Um, I didn't really use that letter because I have postdoctoral fellowship from Mayo Clinic and I've been with my mentor for about 6 years. And David is like my cornerstone. He's like, his letter will take me anywhere. I know that. So I carried one letter, which I thought was very strong. I don't know the content of his letter, but I've been told it's very strong. And it's my research letter. So during residency training, I faced a lot of barriers when it comes to matching for a fellowship. New program, don't even have access to enough medical hematology oncologist. But we have large volume, but we have only one person that I rotate with. And this is a community practice, which means they're not academically affiliated. We don't have anything fancy or cool. I've only heard about CAR Ts and bone marrow transplant far, far away at conferences. So I don't have any luxuries that, other people get. But I thought I'm a fighter. I will go any extent to what I want for my dream. I cannot let anybody tell me that it's too big. I'm sorry, I can't hear those negative things. I just run away from them. Even if it's family, I will cut you off. So that attitude actually really served well because people couldn't really say no. I had so many barriers going through the application process, but once the interviewer started coming through, I think I just explained how passionate I was about this and how much I really wanted this. And then really give a very strong interview. Give it all you've got, really prepare and know the programs. When they ask why us, it has to be specific. It cannot be something very generic like, oh, I want to be a full hands-on clinician or oncologist. No, your program is known for myeloma. You have a specialist in myeloma that I like his work. I want to train at your program because I want to be a myeloma specialist and I want to work with him. That it has to be that specific. And I can still process that I matched at Stanford. So, but the story is about people. I think I wanted to host this session is because there are a lot of applicants who want to reapply and going through that heartbreak and career transition thoughts. I want to utilize this forum to hear about three people, Beatrice excluded, but Beatrice faced very unique challenges like I did, especially Milan and Sindu went through this emotional process of should I do this again? Is this worth it? Um, what is my life going to be kind of thing. So I want to utilize this session to hear about them. Okay. But I'll come
Definitely.
another day to tell about the story.
It's very inspiring, though, must say.
Yes, it is inspiring. I definitely wanted to hear what Tulsi had to say, even though she is hosting the session and I'm only the co-host, because not everybody knows what she went through. Coming back to you, Milan, when you worked as a hospitalist and when, hold on, somewhere something is echoing. Let me see. Hello?
Yes, can you hear me?
Yes, I can hear you, but I think it's still echoing. I don't know why.
I didn't get it. Can you say it again, please?
Can you hear me now?
Yes, yes.
Okay.
It's still
So
echoing.
when you were working as a hospitalist and decided that you were going to apply, how did you know what you were doing at this point in life was taking directly to Heme? How did you know it was quality work and it would get you there?
Sure. So yeah, certainly, it was definitely challenge because I was out of this training process for last more than 7 years. Uh, Fortunately, I had a good cancer team here. Actually, I work one of the community hospital affiliated with a bigger healthcare system. So we have a good cancer center with at least 5 or 6 oncologists in the group. So I met with those folks and I rotated with them for about 5 to 6 months. So as a hospitalist, I work week on week off. So in my off week, 3 to 4 days, I will go in the clinic and I will shadow them, And I actually have been working with those oncologists for last 5 6 years, so I had those connections with the group, so that really helped. So that was one thing. And second thing, in my profile is also different than others, probably because I don't have much research on my belt. So I collaborated with few of my friends who were working in a different institutes, and I was able to publish few papers. Few were actually oncology related, few were not oncology related, but I think things worked out. In my profile as a hospitalist, I got involved in different leadership roles in my hospital. I think that really helped me. Those were actually my main talking points in my interviews, and I 100% agree with Tulsi. Uh, by the way, wonderful story, Tulsi. And I totally agree with you. Interview is really the big thing, because once you get interview, that means you are like any other candidate who they are interviewing. Now, your main goal in interview, I think you need to understand that you want to be ranked, because on average for every spot slot, they are like interviewing for at least 10 people. So now, for example, this program has three positions, so they are interviewing 30 people. So you want to be ranked in those top 8 or top 10, I would say, so you can safely get matched. So, try to reach out their fellows, just, digest their, like dissect their website, see what is in the news about that program. Talk about that so they know that you really know them, and you are really interested in those folks. And as Tulsi said, if you can also see, their faculty, and, if you want to work with someone in the faculty whose interests align with your interests, I think that will also be a great point. So interviews really, I would say, interviews really the biggest highlight of your journey in this fellowship application process journey. Um, and what else I did? Yeah, I think my role as a hospitalist, I really presented myself well, what I did in this role, or what I was able to achieve. Yeah. Any other specific question, I'll be very happy to answer.
I think at this point, I'll throw the forum open to everybody else who's waiting to ask questions.
Hi guys, this is Tulsi. So if anyone in the group wants to ask any question, for example, what should we do this week? Should I go apply for hospitalist position? That is a big question, right? And should I do or should I do fellowship? That's like the big, and we know there are some unfilled positions right now. And should we reach out to them, then make up our mind? Like what time is of the essence? So I guess people are nervous, like, should I do fellowship? If so, which fellowship is better? We have heard in the past from hospice and palliative care fellowship people, but I'll bring them in a later date. But what helped you decide hospitalist route versus fellowship, Sindhu, and this, and others?
Um, so that's an excellent question. I remember when I first did not match, it was painful, but I knew I wanted to be in this field whatsoever. I was being flooded with geriatrics and palliative emails. I think they get to know once you don't match. And at that point, my reflex was just emailing back saying that I'll take any opportunity of scheduling interviews with palliative and geriatrics. But then it took me a day or two to process that did I really want to do another year of a fellowship, which was not hemonc based, or did I want to do a hospitalist? So if I had not done the 1 year non-accredited fellowship, I would have probably considered. But since I'd already done a 1 year cancer therapeutics fellowship, I decided to go the hospitalist route. Even the hospitalist route, I decided to do specifically onco or myeloma hospitalist because I felt hematology and oncology is such a wide field, and I could probably get a kickstart or basic foundation of one disease pathology or various pathologies while I'm doing the hospitalist. And also the week off I can utilize in doing research, being in touch with, like just building contacts and building my research CV. So that was the idea behind choosing the myeloma hospitalist. But on the day of the match, I do remember I did interview with a palliative program. It was a late evening, 7 p.m. interview. And it was very evident in that interview. And the program director was pretty sweet enough to say, hey, why don't you sleep on it for a day, digest the fact, and then let me know if you're still interested? Because I think it was so evident in my conversation that I was not completely inclined to doing a palliative fellowship. And that kind of gave me a perspective to think further and decide that I'm just going to pursue the hospitalist route in hematology and oncology. And after that, I started like applying to all the university positions. I used the websites ACP and NEJM to look for hospitalist positions in university programs which have HEMONC, but I was looking specifically for mid-size, small to mid-size university program which could fit my profile rather than going to a large program which is extremely competitive. There are advantages if you do a hospitalist position in MD Anderson. Yes, there are a lot of advantages because it's got a big name, but I wanted them to know me so that I can match in the same place, or I could at least build contacts was my goal. Um, and during my interview process, I realized that there are two kinds of hospitalist positions that one could avail. One is you are a general hospitalist, but if you tell them that you're interested in hematology and oncology, then they tend to give you more hematology oncology based patients to use. So you can build a rapport with the oncology department and work your way through the ladder. And they usually prefer you to work at least for like 2 years, like you work at least for 1 year and then apply the second year so that they know you. And this was something that I was told during the interview process itself. Whereas in my current position, it's the same thing. They also said that I would be considered mostly, during the second year of my hospitalist job. But here it was mainly dedicated to myeloma hospitalists because I wanted to get better in at least one disease pathology rather than knowing everything in bits. There's still a lot more to learn about myeloma, but I just wanted to get used to it. That was my thinking process behind choosing the myeloma hospitalist job at UAMS. So I hope this answered the questions.
Yeah, I
Yeah,
think
I
it
think
did.
it did.
Tulsi also has another question. When you were reapplying, did they ask you why didn't you match before or why are you doing this again?
Fortunately, no. So I think the reapplication was considered positive in certain places because I remember one interviewer telling me, I don't want to ask you why HEMONC because you seem so dedicated to HEMONC. Your entire CV shouts HEMONC. And then I think once they'd asked me, like, did you apply last year in the same program? And I said I'd applied, but I could not interview. And they're like, oh, that's our bad. We should have interviewed you last year, kind of a thing. But I don't think it can be taken as a negative thing, at least in my perspective. I think it should be taken as a positive thing because you're still dedicated. You went through the match, you did not match, and you're willing to put in that extra year to get, get into HEMONC.
Yeah, apparently there are many people who have been asked this
Been asked
question.
this question.
So
So
I don't
I
know
don't
if
know if
I would like to, Shri, I would like to add on that question because there was for myself this was question: should I leave hospice and go do another fellowship year, before I can apply for my like HEMONC fellowship? So I did a lot of research. I met with a lot of folks who went through that route, and what I found, I actually found someone who did a palliative medicine fellowship, and after that palliative, he applied HEMONC. He couldn't get it. So next year he did geriatrics fellowship. And even after geriatrics, he couldn't get into the fellowship, Heme fellowship. So what I learned and there were a few other stories. There were people who were able to get it. There are people who were, so there is no guarantee. I think the one thing whoever is looking into this alternate route, they should think that whatever you are doing, just get most out of it. And I think I think if you're really dedicated, you really want to get heme. I think if you're working as a hospitalist, especially in a schedule where you're working on and week off, if you can use that off week wisely and you collaborate with different places and try to network and connect with a lot of people, I think you have more chances. And certainly, if you're doing a fellowship in a program, you might have chances in getting into the same program. I think those will be the best chances in the getting into the same program. But other programs, I feel if you're working as a hospitalist, you're able to publish, you're able to heavily network, you will have equal chances and you will actually get better pay. Yep. Those will be my two
Beatrice has
cents.
something to add too.
Yes, what I just want to add something that while applying for EMONC, my advice would be that you should be very aggressive about it. What I did, like for me, nobody placed a call for me, nobody sent an email for me. I reached out to these programs. Immediately, I submitted my application. I sent letter of interest to all the programs I applied to because if I spent my money to apply to you, then I'm interested in you. So I sent letter of interest to all the programs. Then and immediately some reached out. I'm like, hey, thank you for reaching out. Like I have over 3,000 people, like over like 500 applications. I won't be able to review all. At least you reached out to me. I was able to sort out your application. That was what a PD sent to me. So then after that, immediately after my interview, just like what I did during residency application, I sent thank you email immediately. I did not postpone that. Then during the ranking process, I sent um I will rank you highly. I did not like mislead anyone, but for my number one program, I told them I'm ranking you number one. So like I reached out to these programs myself. So I believe you might be in a situation whereby you might not get help from your program or anybody to make a call for you, but you should be aggressive, show more enthusiasm, and reach out to this program. And most times they listen.
I agree with Beatrice. S- I will say something. Success have many parents, and failure is usually an orphan. I did not have anyone in my program make a call for me. In fact, my hemong attending, when I asked if he could place a friendly email to one of the programs I ranked actually low, the person just said, "Nah, I don't think it is effective." So when I approach people and if I immediately get anything negative, I don't pursue it further because I don't believe in pushing people to do a letter or make that call. So I got zero help from my program. I'm reinstating that zero help. Okay. And I'm openly sharing that, venting my frustration because this is something I really want. And I get zero help, not being able to go for electives and no one to call. So I went back to David, who's now retired, very eminent. So I said, David, I have two programs that I really would love to train in. It was University of Chicago and Georgetown. I finished my interviews. I got very good vibes from them. I want you to let them know that I would be very happy if I train with them because they were not my number one program. My number one choice, Stanford, I reached out to my community mentor, Dr. Lavallee, who I did palliative care rotation, who wrote me a letter and said, Dr. Lavallee, you are my attending. You wrote me a letter. I want to go to Stanford. I'm ranking them as my first choice. If you can reach out to them and send that one more nudge of support, would you be able to do that? And She agreed, and I let program know. That was my number one choice. All the others, after the interview, I wrote a handwritten card to all of them. And I had also thanked them for the interview opportunity. And I said, I'll be very happy if I were to match with you all. That's it. I wanted to share that you're going to meet so many barriers, but you have no time to sit and cry or vent and whatever, because you got to come up with the next solution. If somebody throws a cinder block at you, then avoid it, find a new route, because you don't have time to revenge and all of that. This is revenge. Matching is revenge
I
for all the
completely agree.
naysayers. Okay? You show them by matching. I even
I
had
totally agree
difficulty.
with that.
I even had difficulty even finding somebody who after interviewing, did not even want to make a call. Think about the amount of frustration that is. And you're a good applicant, not a chief. You're a good applicant. You have done so much of effort. You've come this far. All that person had to do was just like, hey, this is a great applicant. She interviewed, please consider high when you rank. That's it. That's all that it took. It didn't happen. But you go to the next person who would be your advocate, and that's it. When life gives you lemon, go, make a lemonade, find orange, and do the next juice.
I
I
completely
totally
agree with
agree with
you.
that.
Yeah.
I always tell my friends, if life throws lemons, the same thing that you said, and if you cannot make lemonade, make orange juice and keep others wondering how you made orange juice out of lemons. So that's what it is.
So
There's
all
no
the
point
people
in
who said
crying
no
over
right
something.
now, they love you because you
Yeah,
matched. They love you.
true.
They love you. Oh my God, congratulations. I don't remember the time where you had to do an MBA elective and I said no. I don't remember the time when when you requested if I could send an email and I said no. That's okay. I'm going to keep it inside because you have to be professional. They're still going to work with you. You still have to finish your attending. Always keep your professional conduct professional. This is a forum where we can share this experience. What may kill you or break you, don't let it get to you, because you will find other inspiring people. For example, Dr. Hadidi. I don't know him. I've met him at ASCO once. I needed someone to read my personal statement. Send him an email. He did that. Totally strange person. In fact, I had to find mentors in Twitter. I would reach out to random chiefs, people I don't know, and I would email them saying, "Hey, my name is this. I train at a very small community program. I need somebody to review my application." And that was Jim Smithy. He's studied at Princeton or went to Yale or Harvard, one Ivy League to the other. He's now a faculty at MSK. Jim actually did my CV review. And I don't know Jim, but he did, because I had invited him to do a noon conference lecture for my residents. That's all I knew about Jim. But you will find people. For everybody who says no, there will be at least two people within the oncology community who will say yes. So keep looking. And I see Fernando joined. I've had few interactions with fellows. There are fellows who will understand your plight and kind of support. And I used that. That's all I could, because I didn't get it anywhere else. I had no option. Twitter was my, you know, go-to place to find people to review or help or find a rotation or something.
I completely agree with what everyone mentioned, and but I just want to like specifically say to everyone who hasn't matched, it's painful, but yes, you can take a day to acknowledge the fact that yes, this year was not your year, but next year is going to be a better year. And I think just working, because we have only like 6 or 7 months from now, and utilizing every every minute is important. And also having a backup plan for the next match is also important, because I had a backup plan if I didn't match for this match, because I did not have a backup plan last year because I was devastated. But this year I was like, if I don't match, I need to have a backup plan. I need to work on research projects. This is the plan. This is what I'm going to do, kind of a thing. So and you know, that is definitely a piece of advice, because you need to be aggressive, like everyone mentioned. You need to like go after your dreams. I'm actually, inspired by everyone here, because in third year I didn't apply because I had limited opportunities and I decided not to apply. But here, Tulsi, Beatrice, they fought for their dream, and it's really inspiring. So if you have to fight for your dream, basically. If
We
anyone
have a
else has any other questions, I'd be happy.
we
I'm
have
on
a
call, so sorry.
question
I'm
from
trying to like rush a little bit.
he's posted on the chat here. How difficult or easy, specifically it's directed to Dr. Khilani, how difficult or easy is it to keep yourself motivated enough through all those years between finishing residency, applying for fellowship, being a hospitalist, going through visa issues? How do you keep yourself motivated?
Well, I will give credit to my wife. So she really supported me. She was with me, and she has been keep pushing me and helping me and keep reminding me this is what I need to do. And I'm very lucky and fortunate, and I'm very grateful for that. That I have few very good friends and who really supported me in this time and kept me motivated. Like I have this one friend who is like he's almost 55-year old. He's like a co-hospitalist here. And I think he was one of the main motivator in my friendship circle who kept pushing me that, I'm young. If he compares me with himself, I'm young, and he really motivated me and supported me in this time. So I think you have to find your tribe. Um, and I'm really impressed from Tulsi. She just shared her story that nowadays world is so connected, social media, and if you attend 1 to 2 ESCO or H meeting, you can actually network really well, and those all connections. Like for example, I went ESCO last year, and I met with someone. It was just a casual conversation for just few minutes, and he exchanged his phone number with me. He was a fellow, first year fellow, and I actually surprisingly got interview from his program. And before my interview, I gave him a call, and he actually gave me insights about his program. And Tulsi is starting that thing. She is actually starting fellow representative for each program. I think down the road that will be really very helpful for the new applicants. So I spoke to him, and he talked to me probably 30-40 minutes, and he told me insider things, and I talked about those things in the interview, and program was very impressed. And I ranked that program a bit lower, but I knew that and when I sent them email for the interview, they actually replied back, and I was hopeful that that program would probably rank me higher. And why? Because of that just one conversation I had. So put yourself uh, you know uh, in the place, and just get exposed to all these situations where you can get connected to the people. And I think those are the main things. And for me, the question how I kept myself motivated, I would give credit to my wife mainly, and my friends.
Any more questions, anyone?
I just want to
I just want to
share,
share,
there are
there are
some
some
strategic
strategic
conferences
conferences
that
that
you
you
could
could
go.
go.
I know we
I know
don't
we
have
don't have
a lot of
a lot of
money and
money and
luxury of
luxury of
time, but
time, but
try to
try to
find
find
high
high
impact
impact
conferences.
conferences.
ASCO,
ASCO,
HASH,
HASH,
the
the
State
State
Society of
Society of
ASH,
ASH,
and
and
State
State
Society
Society
conferences
conferences of
ASCO,
ASCO,
because that's
because
where
that's
you
where
will
you will
find
find
concentrated
concentrated
group of
group of
programs and
programs and
faculty
faculty
and even
and even
fellows.
fellows.
Poster
Poster
sessions.
sessions.
you
You
will
might
meet
meet
fellows.
fellows.
You
You
talk to
talk to
them, they
them, they
share
share
tips.
tips.
When
When
you come
you
at the
come at the
interview,
interview,
you
you
will
will
mention, hey,
mention,
I
hey,
met
I
Dr.
met
So and
Dr.
so
So and
at
so
this
at this
conference.
conference.
He
He
talked about
talked
the
about the
trainings.
trainings.
If you were
If
to
you were to
name
name
drop,
drop,
name drop
name drop
people in
people
the
in the
program
program
and
and
share your
share your
enthusiasm,
enthusiasm,
that's
that's
helpful, and
helpful, and
ultimately
ultimately
someone may
someone may
help you.
help you.
They
They
amplify your
amplify your
work.
work.
Sometimes I
Sometimes
didn't
I
have
didn't have
faculty who would
faculty who would
directly help,
directly
but
help, but
they would
they would
retweet my
retweet my
work.
work.
Anything
Anything
helps.
helps.
Any
Any
questions? I
questions?
think
I
I
think
have
I
two
have two
people
people
here
here
who
who
want
want
to
to
ask more
ask more
questions. We
questions.
can
We
go
can
with
go with
Card
card
first.
first.
Yeah, sure. Hello, can you hear me?
Yes.
We can hear you.
Yeah, congrats everyone for your success. And so my question is, so I'm an internal medicine applicant that is going for this season. I'm working with Dr. Tulsi. Can you share with us how these match applicant interviews are different from fellowship applications? Is it a two, I mean, very different, or it's the same thing but for a different positions?
I can take this. Yeah, it's very similar, at least according to me, because I've gone through the fellowship match process twice, and the residency match process like 5 years ago. But from what I remember, is it's still using the same ERAS system. It's the same 3 letters plus one additional letter. And you might have like extra features that were added this year, like your geographical preference was new, um, and your I think the 10 most significant um, things that helped you decide hemonc. I think if not, please correct me if I'm wrong. Is that what they asked? Like the 10 most significant things that inspired you to become a hematologist and oncologist. So you had more space to like put yourself out there and explain yourself and see what you've done, like be it research, be it volunteering, be it your hobbies, just to bring out your personality out into the CV. Other than that, I thought it was pretty similar to the residency application. It's just that the season is a little shorter, because you submit your applications in July, and then you start getting interviews in August end. It goes on till like November first week, and then rank order list is submitted by mid-November, and you get your results by the end of November. So in that way, I think fellowship season is a little better because your anxiety is for a shorter amount of time.
And I would like to add into that, in residency application, you have this option of signal the program where you can, I think, signal up to 3 or 5 programs, I believe. And with fellowship, we did not have that opportunity, number one. And the second thing is the applicant pool for fellowship is smaller compared to residency. Like for example, internal medicine residency, they have like somewhere between like 4 to 6,000 applications every program. But for fellowship, they don't have those many applications. So there are chances if you send an email to program, they might respond you. There will be better chances compared to internal medicine residency or any other residency program application. So that those will be other two differences, I would say.
I wanted to add something about the conferences to what Tulsi had mentioned. Yeah, everybody knows about ASCO ASH, but there are like early career development areas in ASCO, and that's for early trainees, residents, fellows, or applicants who are applying for fellowship, or even early job interview available for fellows who are interviewing for jobs. So I found this place really helpful where I met a lot of people. You do have one-on-one sessions with fellows and faculty that you can utilize. You have to just book your slot a little prior to the conference through their website, and that kind of gives you a platform to like introduce yourself to fellows or faculty and be in touch with them and build a contact, because mentorship is really hard to find, especially if it's not available in your residency. So you'll have to look for outside places. Twitter is excellent, like Tulsi mentioned, but it can even get better when you see them in person and then be in touch with them through Twitter or through contact. Or you're in touch with someone through Twitter and you meet them and ask, or go introduce yourself. Don't hesitate. And you can also like print out your CV or a personal statement, keep it in your bag during ASCO, give it out in hand. Just shows some dedication rather than emailing it to them, because they have to hold that paper. So they will see something in your CV at some point or the other. So along with ASCO, like state conferences, for me, Florida State Conference, FLASCO, was also played a huge role, because it's a smaller group of physicians, fellows. All the fellows from Florida come there, and you have like 3 to 4 conferences in a year, like a fall session, a spring session, a disparity session. So they'll see you multiple times and they'll get to know you multiple times. Not all states have state conferences available, but you can go to the next big state, because Arkansas doesn't have, but Texas has. So I can go to Texas. So you'll have to just look for the best available smaller conferences if you want to build your contacts locally. And then the other conferences, along with what Tulsi mentioned, was GI ASCO and GU ASCO. It's also a smaller group of physicians, but you can interact with them on a more personal level. You can also submit to them. I think the acceptance rate is a little higher than ASCO, if I'm not wrong. So yeah, you can utilize all these. And they also have volunteering opportunities in ASH and ASCO. So that can also, you can put that in your CV for the next academic year while applying, because it's not just rotations and research. They want to see an overall personality. I think volunteering can also help, just to like improve yourself, to know what's happening out there. Lymphoma Leukemia Society had a volunteering opportunities where you actually are trying to see if patients of younger age are eligible for an educational fund. And I had enrolled myself into it, and I was asked about it during an interview about how it works and what interested me in becoming a volunteer there. And I think that kind of took the interview in another path, rather than just asking about my research or my clinical experiences. So you can utilize all these through conferences.
Just want to add something real quick. I think it doesn't really have to be just Haskell and ASH. You can also attend the ACP, your regional ACP and the national ACP. And for me, I did more of case reports. Then for ASCO, I do not know how to do systematic review and those big stuff. So I did not submit anything, but I went and I wrote it in my CV that I attended ASCO, because they asked us to list 10 things that are important. I listed it, what I gained from the ASCO, how I organized my meeting and everything, what I learned from ASCO. And not surprisingly, they were talking about it during my interview, like, oh, you went for ASCO meeting and you did this, you did that. But I did not present anything because they did not approve. I think they were not approving case reports. So whatever you could do, just make use of it and put it in your CV. Everything that is going to contain that CV should go in, and it will speak for you.
I think we have more people who've raised their hands. We've Milan, we can't hear you.
We can't hear you. Can you hear me now? Yes, so I wanted to add, I totally agree with Beatrice. And then I really am surprised that you put in that your experience and you made sure that because for my application, I wanted to put it, but I didn't know where to put it. So that's nice. That's nice point. And also Sindhu made a great point about those mock interviews or one-to-one interviews. And I didn't know about it, and I knew about that in the conference, and it slots were already filled. So if you guys are planning on ESCO, I don't know if Ash has similar opportunities. I don't know, but for ESCO, for sure we know. So if you're going, make sure you make an appointment ahead of time. And also, Tulsi shared a link about mock interviews with ESCO, like via Zoom or Teams. Actually, I had that interview with one of the one big guy, from that platform, and that mock interview was really very helpful, and it helped me a lot in getting prepared for the interview. So please don't, those are like very easy free opportunities, don't miss those, and try to get maximum out of all of those options and opportunities. Yep.
We have two more hands, I think, and five
I
more
think
minutes.
Milan has 4 hands.
Any more questions? We
Um,
have, I think, around 1 minute and 20 seconds left.
I have a question. Sorry if I may go. Okay. Thank you so much for the opportunity of this forum. It's been a very insightful and informative session. I wanted to find out what you think about someone in a community program, but no opportunity for elective due to some circumstances, maybe outside elective in a monk fellowship program, but would you encourage the person to go ahead and apply still, or just maybe do the non-accredited fellowship for 1 year, or like just to have some sort of experience in a monk before applying?
I can take this. So I come from a community program, and I was the first candidate. Even though my community program is old, no one in the past has applied for HEMONC or matched into HEMONC. So I was the first one who showed interest. And we had one community oncologist in the hospital, and it was a COVID time. So missed out on a lot of electives. I till today regret the fact that I did not apply during my third year. So I think that should not hinder your fact of not applying. You should apply, see your chances, because you never know, you might offer something to the program that you don't recognize. So about if you can get even like one letter of recommendation from your HEMONC physician in your hospital, and if you can use your home school, medical school, or volunteering, like what Tulsi had mentioned, if you can find someone who can also write you a letter, if your letters are good, then go ahead and apply. Because I have a friend who did not have even one HEMONC letter but still applied. Unfortunately, he could not match this year, but he tried. So but at the same time, you can reach out. There are a lot of like big institutes who are looking for like research volunteers. You can reach out to them, develop a rapport with them in the next like 5 to 6 months, and then see if they can write you a letter, and basically utilize that. And we have a couple of conferences coming up right now, especially like San Antonio Breast, ASH is coming up, GI ASCO, GU ASCO is coming up in Jan, and then state conference is coming. So you can utilize all these opportunities to build a rapport with someone, so you can, network and still apply this year.
Just to have real quick, so my elective was actually declined, but what I did was that I still had my 4 weeks vacation. So for the whole PGY2 year, I did not go on vacation. So that was what I used for my elective, for my away rotation. So the good thing was that I started the process early. So I kind of started like 6 months before. So when I started seeing these challenges, I started working towards it and looked for a way to overcome them. So you can also think about doing that. It could be maybe 3 weeks of your vacation time. It could be 2 weeks. You can also use that if your program will allow.
Thank you so much.
Wow, this was a wonderful session so far and so informative. I think we have two more hands. Go up here. Do you guys have more questions?
We are going to wrap in 2 minutes, but if you have any pressing questions, you can email one of us. I'll be more than happy to share our common email, or DM us in Twitter, or just reach out to us and we'll be happy to help. Okay. But I see Fernando, so I would like him to introduce himself.
Sure. Hi, everyone. I'm Fernando. I'm a fourth-year Jerry Hemonk Fellow here at UNC. The chair of the ASCO Training Council. And I think what people have said so far resonates with my story, even though it's 4 years dated. I came from a community program as well. So, I had one on community oncologist, limited research, limited rotations away. But one of the things that I think I was very clear with was that my personal statement, my limited research, was aligned. And where I was applying, I wanted to make sure that people understood that despite not having, a thorough training like a master's or a PhD, that's okay. My passion was pretty firm and very clear. My personal statement said, this is who I am. I'm a Latino. I love Hispanic cancer disparities. I see this in the clinic. The little limited research I did with the barriers that I had, I was still able to do something focused on Latina breast cancer, and I was able to get it into the San Antonio Breast Cancer Symposium. With all that, I was very, very clear. And I said, I am only missing training in HEMONC and training in research, like methods training, formal methods training. That's all I need. And that was very clear, despite the fact that I came from a community program. I applied to only 20 programs. I applied to 10 community and 10 academics. My personal statement, I said, I want to be an academic oncologist. I want to be a Hispanic cancer disparities researcher, and I want to be on the ASCO committee, the ASCO Health Equity Committee. Very clear on that. And so 8 interviews were academic and 0 interviews community. None of the community programs I applied to, I was invited to. All academic, 100%. And there were 8 out of 10 that I got. And so it's possible, but I do recommend what people have been saying here. Take advantage of every single opportunity that ASH, ASCO, AACR, and everything has. One of the things I was talking to another TCAG member recently is one of the things that we all have is that we know every single opportunity, every single prerequisite for each opportunity. And we know roughly when the dates are for all of those because we were such gunners that we knew we couldn't let any of those opportunities pass us by. I knew when I was eligible for the ASH honors. I knew when I was available for the Minority Recruitment Initiative. I knew when I was available for the Ask Virtual Buddy system. I knew like every single opportunity. I knew the prerequisites and I had written down the dates. So that is going to be very important. People have mentioned ASCO. Definitely go to the trainee lounge. The trainee council, which is made up of about 40 fellows from across the world, we run it. We are there. I submitted when I was a resident to the ASCO Abstract Forum, the resident and medical student abstract forum. Definitely do that. You'll meet other people. You'll meet other TCAG members. Um, and definitely take advantage of all the opportunities that there are because there's a lot. You'd be surprised. So even someone from a community, I had like 4 or 5 things from ASCO. I did, there was a presentation that I was able to go to, a conference that I was able to go to, the virtual buddy, even, I mean, it was just riddled with ASCO, ASCO, ASH, 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 even though I was coming from a community program, even though I didn't have these stellar letters from, nationally recognized researchers, all of that fell by the wayside. Nobody, in fact, and here's one of the things, the network is really important, but I got burned. I reached out to all my network. I reached out to the fellows, to people that I thought I knew. I did not get anywhere with any of them with no network, basically. No one helped me out. And so despite barriers, I think that all of you guys have done a wonderful job of just having that passion, you're proactive, and you just don't take no for an answer. That is the same quality that I've seen in all of my peers, every single one of them. And so keep that flame in your belly because it pushes you even further. Because even when you're in HEMONC, it keeps driving you. It doesn't go away. It actually gets bigger because now you have at your disposal all of the things that you were missing to really be successful. So now they're there, and now you can actually do much more. So this is the right time to start thinking about next year. It's not 2 or 3 months before. It's now, actually. I would send out a message to people. So when are you going to get ready? Now? Like, people who have matched, they're done. That's it. You guys are up next to bat. So you should be working on your personal statement and finishing up your research. You should be looking at the rotations and the timing. So, but anyways, meet me at ASCO. Say hi to me. I sacrificed my entire ASCO annual meeting last year to stay in the trainee lounge. I was there the entire time. I didn't move because I wanted people to know me. I wanted to keep up with people. I had about 15 mentees this year that I met from ASCO that I was, trying to help as much as possible, right? While still doing my activities. So I will take as many and I will help as many people as I can. There's different needs for different people, but sometimes you just need to hear from someone who's been there. So I am available for everybody and anyone. But it's a lot easier if you go to ASCO and I meet you and I shake your hand and we have some coffee together and talk things through. So but good luck, everybody, and congratulations to those who have matched. It's remarkable, and consider applying for the ASCO Training Council. We look forward to the next leaders as well being a part of our committee.
Thank you so
Thank
much.
you all. Thank you, Dr. Diaz.
Thank you.
And good luck, everyone. And if you have to reach me, I'm available on Twitter, and I'm going to send my email here. And anybody who would like to reach out, you can reach out.
Thank you, Dr. Diaz. You are our surprise edition. I'm so glad you joined. All right, guys. So that's it. Do let us know if you need any help and keep going. Okay. Don't let anybody say no. That's just not an option. Okay. Good night.
Thank you, everyone. Good night.